Julie and Gretchen from Anthem. They're going to tell you all kinds of fun.
Thanks, Anna. Again, my name is Gretchen Hendricks, Large Group Account Manager with Anthem Blue Cross Blue Shield. Today, Julie and I, she's the Clinical Wellness Manager at Anthem. We're going to walk through products and services that you more than likely know that it's under your plan, but sometimes it's those bells and whistles that you just maybe forget about, or you know they're there, but you're just not sure quite how to get to them and how to utilize them. So before I get started, I wanted to shout out to Anna and give her some kudos on the creating and implementing the wellness committee, as well as getting it moving within Buckingham. Buck 360 is a great wellness program for you guys that you guys have in place. So, and I do understand you're going to get 10 points for today. So, awesome, just for attending. So we're going to walk through the products and services, like I stated, and I forgot I'm supposed to click. Oh, there we go. So I'm going to first go through an ER update. So most of you within the past couple weeks should have received a letter in the mail. This is just to let you know that the ER that you already have in place under your plan today, we're going to start reviewing the claims for non-emergency situations and further. So those non-emergency situations that could come up are things like the flu, the common cold, mild rashes, mild fever, stuff like that you could go to, alternative care settings, more appropriate care settings, like the urgent care, our Life Health Online. You can always call the 24/7, the nurse line, which Julie's going to go into. So, but that is just to let you know that is there, and we're going to help you, guide you, and inform you so you make better healthcare decisions. So what are some non-emergency ER claims, and what are the circumstances around to cover those types of non-emergency situations in the ER? So if you have any child under the age of 14, the ER services are not going to be denied. If you can't find an urgent care center or retail health clinic. Retail health clinics are those Walgreens or those CVS Take Care clinics, under Walgreens, within 15 miles of where you are. If you were directed to the emergency room from another medical provider, or any visit that occurs on Sunday or a major holiday. And of course, at any time, if you feel that it's a true emergency, we want you to use the emergency room. We just want to make sure that the emergency room is there for true emergencies. So with that, I'm going to let Julie walk through the products and services. Oh, no, I'm not done. Forgot. Sorry. So this is a quick snapshot, an illustrative, just to kind of show you the plan savings that you can save from the emergency room to urgent care center or retail health clinics, and the time you can save as well. So, there are several different plans at Buckingham. So you're either going to be on the HSA plan or one of the PPO plans. So you're either going to have that $250 copay at the emergency room or deductible and coinsurance. And then the urgent care center would be, the $75 copay versus deductible and coinsurance. That's a big savings. And plus, you go to the emergency room and you're waiting for 4 or 5 hours to see an ER physician, versus you could probably go to the urgent care or retail clinic in half that time. So it's just about informed decisions. So with that, I'm going to turn it over to Julie.
Thank you.
And we're going to go through the Life Health Online.
Yeah, one of the services that we have, Life Health Online. Is anybody in here registered? Yay! If I had a prize, I'd throw it at you right now. Life Health Online is our virtual doctor visit, and you actually get a doctor on the screen. So you can connect with the doctor on any device that has a camera and sound. We're going to walk through a member experience in a minute, but the doctor's on the the call are really all board certified, really fabulous providers. They range from primary care doctors, internists, pediatricians. There's also a behavioral health component that you can have talk therapy, and that's with a psychologist or a licensed social worker. So there's two avenues you can get into. Starting January of 2018, there'll be psychiatrists on the behavioral component, which is just newly released, and they'll be able to manage medications as well. So I think that's a real game changer for behavioral health medicine, because you can actually sit in the comfort of your own home and have some talk therapy or some behavioral health assistance. So it's a highly sought after practice. We just get the best of the best, because people say, what kind of doctors do this? We don't even know what they're wearing. They just look nice from here on up, and they're sitting behind their table and have their certificates on the wall. But it's shift work. They absolutely love it, and they don't have to worry about an office, and the line is really long of very highly qualified doctors to get into this sort of kind of a new practice. So I think if you want to pull out, we're going to watch the video because it just explains it where.
Hi, my name is Dr. Mia Finkelstein, and I'm one of the board-certified physicians that you can see when using LiveHealth Online. I've been practicing family medicine for 21 years, and have been treating patients just like you using LiveHealth Online for over 4 years. Video visits using LiveHealth Online are a great way to access quality health care when your doctor isn't available, and it's super easy to use. Let's see how it works. From your smartphone or tablet, download the free LiveHealth Online app, or if you're using a computer, go to livehealthonline.com. To get started, you'll want to sign up or log in. Select LiveHealth Online Medical to view the board-certified doctors who are available to see you. Then tap the doctor's profile to view where they went to school and their specialties. You'll also see the doctor's rating, which is based on patient feedback. To choose the doctor you would like provider. Next, answer some questions about your health condition and medical history. Then you can select a pharmacy near you in case a prescription is needed. I see from your notes that you have some irritation on your wrist. Can you tell me more about it? Doctor? Actually, I don't know what happened, and I wake up this morning to this rash around my wrist. Mind putting your wrist up to the camera so that I can get a better look at it? Can you see that, doctor? Yeah, I can see it. It looks red and raised around the wrist. Yes, it does, doctor. LiveHealth Online is quick, easy to use, and more convenient than a trip to an urgent care since the doctor comes to you. It's a great option for care when you have a common health condition like the flu, a cold, cough, pink eye, skin infections, and more. If your doctor chooses to prescribe any medication, they will be sent to your pharmacy of choice. After the visit is complete, you will receive a secure message with a summary of the visit. People who have used LiveHealth Online enjoy quick, easy access to quality health care with no appointments needed. So give it a try. Sign up today at livehealthonline.com or download the free mobile app. I'm sure you're going to love it.
That kind of walks you through a member experience. The sign-on, which we like to have people do ahead of time, because if it's in the middle of the night and your kid's throwing up, you don't know what to do, chances are you're not going to take 10 minutes to put in the pharmacy and some medical history and things like that. You just want some answers right away and quickly. So we like to have kind of registration campaigns why we're here talking to you today. So you get it in your phone, you get the app ready to go, and then when you need it for these kind of common ailments, you're all set. And the setup process takes about 10 minutes. You need to put a credit card information in so you have a method of payment. If you have, do they have flex cards? And you can use a flex card for that as well. The worst case scenario is going to be $49 on the HSA plan or your office visit copay for the rest of you on other plans. You will know ahead of time what your charge is. If for some reason the doctor can recognize just in the first few minutes that I'm not going to be able to help you, then they'll back the charge out. If they spend a lot of time trying to figure out what is going on and what should be the next steps, then you will be charged for the visit. So that's really nothing different than if you go to a provider and they, transfer your care to somebody else. What I like about afterwards is you get an email from the doctor with your visit, so you can send that to your provider so that they'll know that maybe you're prescribed medicine or can kind of stay tuned in with what's happened in, off hours. So 24/7, it's a great deal on holidays. I know some people in the office use it Thanksgiving morning for a sick kid, and you don't have to go anywhere. And it's very convenient, and we'd like to just make sure that you all have the opportunity to put that on your phone and get ready to go. Plus, once you're registered, you're going to get an email reminder once a month, like, hey, it's flu season, or to kind of remind you that I got this app, I got this way to get some care quickly that's really quality care that that I can use. The average visits are 10 minutes, so pick a, and that's from user experience, so you can see how everyone is felt after the visit, and up to 5 really high ranks on the experience as well as the providers. Does anybody have any questions about Live Health? So you'll need your group number and a credit card when you kind of sit down, to put it in. And if anybody wants some help getting the apps today from, the iTunes Store or Google Play, you guys are all smart, probably more tech than us, the rest of it. But, we're here to help you get those all ready to go. The next thing we like to talk about is 24/7 Nurse Line, just so nobody forgets about this. This is free, and it's for anybody that's a member. You just call the number on the back of your card, and it's for those kind of questions maybe to help you decide, should I go to the emergency room, on non-emergent kind of things? Should I call Live Health Online? It's a great first place to start. And I always encourage everybody to put it in your phone, in your contacts, because we always have our phones. So what if you're camping, you got a bug bite, I don't know, what should I do? I mean, you can take a picture, she can help you decide what's the right avenue. Can I wait till I get out of the woods? Do I need, what do I need? So it's kind of nice to just to have it in your contacts. Make sure your kids off at college have it in their contacts. It's a good kind of a first step to kind of get triaged on what to do. And a lot of times they can just do complete self-care, kind of guide you what to do on your own, so that within the scope of their practice, so that you don't have to go anywhere. The other program that we have is our Future Moms program. So this is our maternity care management program. So it's for all expectant mothers. Don't have to be high risk to be in the program. And we don't reach out to people that we see a pregnancy claim. A couple of reasons. One, most of the time the claims don't come kind of till the end, and we've missed the whole show. Secondly, we don't know the nature of the pregnancy, or if the pregnancy is terminated for some reason, so we don't do outreach. So we're counting on members to be aware of the program, and also HR, so if you're keeping them aware that you have a pregnancy, that they can help us get that message out to you, that that's a service we have available. It's a nurse. It's dedicated to you. You could talk to her every day if you want to. Sometimes it's nice to have a nurse in your pocket. And I'm a nurse on our floor, on the sales floor, and sometimes I feel like the 24/7 nurse. I've been called in, hey, come to the bathroom with me, look at this rash on my back. Everybody needs who all has a nurse friend? Everybody's got a nurse friend you pester continuously. We love it. So this is like having a nurse to help you navigate this pregnancy, and there's set appointments throughout the pregnancy, and also after you bring that thing home, now what do I do? You're kind of lost. So that postpartum help is really important. Good outcomes on this program with getting babies more to term and lower birth weight babies as well. So reach out. If you never know where to call, how to access these programs, if you just go to the number on the back of your card, they can transfer you all around inside Anthem anywhere. So don't have to worry about trying to get a specific number. And then our condition care program. This is our disease management for those conditions that are chronic, that if they're kind of managed poorly or not managed at all, can really cost a lot of money, as well as a lot of emotional strife for the person that's dealing with the disease and their family member. So it includes asthma, diabetes, heart failure, coronary or artery disease, and then like emphysema is that obstructive pulmonary disease. So this is a nurse that's assigned to you to help you with that condition that you have. And you can well as touch point with her as many times as you want. This is an outreach program, so it's based on claims. So for instance, if you're an asthmatic, when we see that you've been in the emergency room a few times with some asthma, that's a trigger to us that maybe you're not managing that asthma as well as you could, or what do we need to do to help you manage your asthma. So we'll do telephonic outreach. And one of the things we're trying to bring it to your attention is nowadays with people posing as the IRS and who knows what, nobody answers their phone when you call in. I don't blame anybody. But we're trying to figure out how can we engage with all of you to help you navigate the healthcare system and then help yourself manage your health care. So part of it is helping you understand that the service is available, and so that you'll know when we try to outreach to you. We're going to leave 3 messages on your phone, and that's a phone number that we have in your profile, which we're going to talk about where that is, so I hope you can all update your profile. And then we'll leave 3 messages. If you don't contact us in those 3, call back in the 3 messages, then we're going to send you a mailing. And the messages go along the lines of, I'm Julie, I'm a nurse from Anthem. You've been identified to maybe have a benefit from one of our care management programs. Could you please give us a call? When you do answer the phone with Anthem, because we want to make sure we're talking to the right person, we're going to ask for you to verify your birth date. And that's a lot of point where people are hanging up, and I don't blame you. But I think if you understand that it's legit, you can also ask, what's the number on the back of the card, or some other kind of verification to assure you that it's an Anthem person, or just reference the mailing, something like that. So we're trying to figure out how, in today's day and age, can we get around some of those obstacles that have been created and think outside the box with some new ways. So we have some pieces that we can give to Anna that kind of walks through what exactly the nurse is going to say on the phone, so when you hear it, you'll be familiar and know this is really Anthem, and I want to get involved. We also have special offers, which everybody likes discounted things. So when you're into Anthem.com, there's discounts after you sign in, so you have to be on the other side of the login. But there's discounts for fitness centers under Global Fit. So if your gym is part of the big umbrella of Global Fit, you can have gym discounts. 1-800 contacts, Garmin devices, pet insurance, Jenny Craig. Gosh, there's just all sorts of stuff, and it changes all the time because it's people that we have a relationship with them, and they just post the discounts on the Anthem.com site. So I think there's even LASIK surgery discounts with some chains. So check that out. And I know that one of our account managers bought her husband a fancy Garmin watch for Christmas, and then we were out talking about this with somebody, and so then she went and checked, and she could have saved $85 if she would have got the Garmin with the discount through Anthem. So it can be pretty significant. Do that, Gretchen.
So the Anthem Anywhere app, who has this downloaded on their phone?
Oh, 2 people. That's why we're here.
This is so you can go to the Google Play or the iTunes Store and download the Anthem Anywhere app. And what this is going to do is give you health care in your pocket. You're traveling, you have children away at college, or you just forgot your insurance card and you need it in a flash. It's there for you. You have your ID card there for you. You can share it with your doctor, share it with your your spouse, your child. But I'm going to kind of walk through the different screens. Now, the Anthem Anywhere app is designed, and it's kind of the same as the desktop, the Anthem.com, which we're going to walk through in a minute. Same username, same password once you get it downloaded as the desktop version. So from the home screen, you can view your summary, so you can view your benefits and coverage. You can find a doctor, view your ID card, which is really slick. I mean, it flips around, and I just think it's really, really cool. And then check my messages, which I keep checking my messages, but I've never gotten a message. So I don't, yeah. So the next is the find the doctor. You can find an urgent care. So no matter where you are, you can pull up your phone from where you are and search if you're in need of an urgent care. Estimate your cost tool, and then you can also contact Anthem as well. There's the view your ID cards, which is pretty slick. You can share it and then flip your card. You can check if you're on the HSA plan and you're heading to the emergency room, you're heading to the urgent care, you want to see what you've met in your deductible, what you've met in your out-of-pocket. You can see at a glance exactly, what you've met. You can view your past claims that have paid, your prescription benefits. The prescription benefits is actually going to it's going to redirect you to the Express Scripts website, which that app will download automatically for you, and then you'll never have to leave or go. You'll stay in the Anthem app, I should say. So, but you can refill your prescriptions. You can check to see the medicine cabinet. So I was kind of playing around in mine the other night, and it actually tells me how many pills I have left in my prescription, so I know when it's going to refill, which I'm on automatic refills, which automatically ships out to me on home delivery. So I don't ever really have to worry about it other than once a year anyway, which is awesome. So, and then view your claims and just an overall account summary. So if you guys, we're here to help. If you guys want help downloading the app today, we're here to help you do that. So,
Does anybody have any questions about the app? The Live Health Online is a separate app, so you can't access that through the Anthem.com, or you can't through Anthem.com, excuse me, you can't through the Anthem app. So just so that you know, you need both of those. We're going to walk through a couple of screenshots. How many people are registered on Anthem.com? Please be more. Yay! Okay, that's much better. Much better.
So same username and password at Anthem.com. Once you download the app, same username and password.
We're just going to take you through a demo of the site and walk through a few things, and there's a few things we want to point out in particular, especially when we're trying to collect those phone numbers so that we can engage with you if you need it for the care programs. So while that's loading, this is just a demo, so we don't have claims or anything loaded in here, but you see, does it have like a laser? See that profile up there? So go in, if you want to open that up, go into your profile, and let's make sure that when you leave here today, it's your homework assignment, that you have that filled out to some extent. Oh, it's thinking. Okay, there it goes. Yeah, okay. So make sure your address is correct, because that's the address we have on file at Anthem.com to mail you EOBs or any other information that we have. And then make sure that your phone number is in there. I know a lot of people don't have home phone numbers anymore, landline, so you can just put the mobile phone number, or you can put your mobile phone in both places. But that's the number we're going to try to call you. So if you happen to put a work number in there, and then we're trying to reach you for a care program, you're feel free to tell the nurse on the other end, this is my work, I don't want to talk about this now. You can call me back on my cell phone at 4 o'clock or something of that nature, when it's convenient for you. I think, does anybody have any questions about this page? Okay, let's go back up. I want to talk about the tabs at the top. So you have the benefits tabs, claims, which is pretty obvious, health and wellness, resources, customer support. So under the benefits tab, it's going to show what program that you have. Have that loaded out so that you understand your benefit, who's all covered on your plan, and all their details. We don't really have anything with this. Under the claims, there's no claims listed here, but that's where you could go find your claims history. So you could see where it's at, how we're working on it. If we're done with it, you can sort. You can print that off at the end of the year if you need that as well. Then the Health and Wellness tab is loaded with all sorts of information, a lot of the things that we talked about today. So you can take a health assessment. And I don't know, do you incentivize for that at all? No? Okay. This is going to end up giving you a score of how well you do from your lifestyle. And it's just something for your own reference that you can work on to improve your score. That is if you answer the questions honestly, of course. Here's some of the topics you can click on. Let's see, let's go down to, there should be Life Health Online in there somewhere. Okay, go back up. Resources, that's going to resources. Okay, there you can sign in for Live Health Online right there if you want to do that, especially like your home phone or your home PC that might have a camera in it too if you want to do that. The same things that are on the app are here, searching for urgent care, finding a doctor, and we'll walk through a few of those and estimate your costs. So let's go ahead and click on Find a Doctor. Anybody get played around with this at all? So we'll go ahead and just say we want to find a doctor. We don't have to put his name in. We're going to look at the specialty. We just want general practice kind of a guy. Yeah, we're going to put in Clayton's. Accepting new patients, and then you can just see how the search looks when it comes up. It'll also, you can search by specialty if you want a female doctor or a male doctor. There's other kind of options you can search if you want somebody that went to a certain school. So you can see the providers, you can see where they're located, and then some quality metrics that they have met. Everybody that you pull up is going to be in network. You don't have to worry about, is this guy, am I going to get some out-of-network bill? He won't even show up there if he's out of network. So that's kind of nice. You can let's compare David to maybe Walter there, just for sake of ease. Then compare now, so then you can compare the two guys. Where they went to school, their quality rating, what people think about them. And you can see some of the designations that they have, the plans that they accept. WashU Medical School, there you go. Okay, go ahead and we'll start. Anybody have any questions about Find a Doctor? Let's go to that. And on the right side over there under Useful Tools, you'll see it's right there, so you don't have to go into Resources. And you can also find a facility or hospitals, urgent care. Let's go into estimate your cost. I know a lot of you are on the HSA plan, so we're trying to help you be good stewards of your dollars there. I don't know why it always comes up Columbus, Ohio, but we'll put in that Clayton. So one thing that we will try to profile here, especially in radiology, there is a huge difference in price, and basically the quality is the same. So we'll go ahead and we'll put in MRI. Let's do about, we don't want brain, how about just lumbar spine? Let's do with contrast though, yeah. Search. So you redid it. Just click the box. Okay. So this is going to pull up, we put within 10 miles, so maybe you want different miles, you know, but this is going to, oh, we got to go bigger miles, don't we? I just turned my head. What? Go back out, let's do the other one. Anybody ever done a cost search to figure something out? What did you look up if you don't know that one? All right, okay. Yeah, we just did it. Good work. Okay, so let's look at just kind of this, your location, obviously, but we can see the price, $348. And now let's go through to the bottom. I want to get, or you can click one of those, so we'll compare, I guess. So there's several pages of this, as you can imagine, but the price range is just enormous. I want you to see how to compare the costs. And most of the time, if you're in with a freestanding radiology center instead of in a hospital, the price is going to be significantly cheaper for you and the same quality of an image. I would say the bigger the building, the bigger the bill. So even if your doctor says, just go down the hall, you know, if he's in a hospital, just go down the hall and have your MRI done there. You can. I want you to be a smart consumer and say, I'm going to use my app. Look at this cost comparison. Do you mind if I go to Metro Imaging, you know, and just kind of talk back to them a little bit? Okay, we can compare with SSM, so $1,000, and it goes up. We aren't even through all the pages yet, so it's going to end up being several $1,000s difference for the same kind of a procedure. So we can compare our selections. Did it help you find the right place when you were hooking up? We're happy with the quality and just random, Metro Imaging. So you can see what some of them, except for plans, if they've had any recognition, which probably doesn't make much difference with imaging. So this is going to connect with Express about anything we've talked about today. Oh yeah, you have to come up by that spot right there. By that little black box.
So we have a relationship.
Get the apps, or if you have any other questions, one-off, you've got to ask a nurse right here, so you can do that. Yeah. Yeah. Yes. Yeah. So if you go, but it changes all the time. Right now, up is like 50%. Anywhere, I guess. I don't know.
So I think mine's just Anthem anywhere.
I bet when you start putting stuff in there, I don't know where. Did already?
We only had 3 boxes. There's 4 boxes.
Well, it's Anthem Anywhere app. It's actually what it's called. I don't know where you're going to go, but yeah, Anthem. Yeah.
And you know what else is nice? I'm just going to add, if you guys have the finger touch, so if you're in an emergency situation, or you need something in a hurry,
Just
touch it and you're logged in and you're ready to go.
That's if you still have your thumb.
Right.
I know. Just kidding. I know. I'm thinking that stuff. All right. Anybody else? Otherwise, we'll let you go back. Everybody register right now. You go back to your desk. I'm giving you 15 minutes. So you can do all your homework. Good shape.
Thank you.
If you have any questions, feel free to reach out to me. Thank you.
As always. Probably good.
Everything happened.
Okay.